So first we want to get into what exactly is ERP for people who may not know or have never done this kind of therapy before.
And I would love to hear at this point in your illustrious career what your definition of ERP is.
Okay, let's hope I don't mess this up.
Well,
all right.
it's not a test.
With OCD, there is it's OC, obsessions and compulsions. The obsessions are the thoughts that come up. The compulsions are the things that people do, the rituals, to reduce the stress that they experience from those thoughts.
Yes, and keeping in mind that the rituals can be both behavioral or non-behavioral, which is what I coined the term pure O.
Right, the purely mental compulsions.
Purely obsessional undoing responses.
Right, just a purely mental compulsion that they're doing to undo the problems or answer the question from the obsessional thoughts.
Yeah.
And weirdly enough, when you get into that and you say, actually, no, thinking about it can be its own obsession, it can be its own compulsion, so many patients that I've had have gone, oh, that's what I was doing. That's just another compulsion. So there's definitely a lot of people who are engaging in the purely mental compulsion.
Right. So what is ERP?
So what is ERP?
Yes.
Exposure and response prevention. So what we do is we take the thing that your brain is trying to warn you about when you have OCD. And so instead of avoiding the thing that your brain wants to warn you about or doing something to remove the anxiety, we intentionally go towards the thing that your brain is trying to warn you about, the obsessions. And response prevention, the responses are the compulsions. And so we stop you from doing the compulsions, the undoing response.
Right. You usually have a hierarchy when applicable.
Right.
Meaning taking the most eensy-weensy minimal aspect of the threat and having the patients gradually immerse themselves in the feared content.
We might build a hierarchy about, let's say, germs. The idea that, like, maybe the doorknob is contaminated. Okay, maybe I can get close to the doorknob. Maybe I touch the doorknob. Maybe I touch every doorknob in my house. Then maybe I touch doorknobs out in public. Then maybe I touch doorknobs on the New York City subway. I still might avoid that last one.
Well, I don't. I will lick any subway pole in New York City for a price.